we delved very deep into your insights and your homeopathic journey into the world of homeopathy and holistic medicine. Let's continue our talks on this second episode and explore more deeply into your experiences and insights. So my first question to you is, how does homeopathy address chronic illnesses differently compared to the conventional diseases?
Yes, Sahana. Actually, homeopathy stands unique because it addresses the chronic diseases. And as I earlier also told you, that homeopathy, the idea of homeopathy came up only with the way that conventional medicine was not addressing chronic diseases in the right way. So we have something called as indispositions and then diathesis, where we understand the individual predispositions to certain chronic ailments. And this we can identify even during their course of treatment also. For example, these rainy days, there are patients who complain of joint pains. It's a kind of predisposition for them. Not all of them come down with joint pains. So this understanding, we treat the patient. Of course, it is little extensive way of treating, but definitely at the end, a patient is cured.
Okay, that is wonderful, I can say, because you always go into the root cause of the disease. Unlike other medicines, conventional medicines, you go to the root cause. And also predisposed, what did you say?
Predispositions and diathesis. How an individual. See, this I tell you in an example. For example, in a family of 4, not all of them will come down with diabetes with the same diet. Okay? Or same siblings, as we spoke. In a family with same siblings do not come down with diabetes. So these are the individual predispositions. Right. Of course, genetic plays a role. Not that we can totally eliminate in our prescriptions, but we understand this predisposition and then we treat the patient.
Okay. So what is the homeopathic perspective in both depression and anxiety cases?
As I already told you, this post-corona we have seen a lot of psychiatric illnesses. So definitely any other chronic ailments will have some time to get over with that. Any chronic disease for that matter. See, homeopathy is good for chronic diseases, but it can't happen in a magic way. Like I have patients who come down with severe acidity for about 10-15 years and they sit in front of me and say, I say, you have developed this illness from past 20 years and you ask me to treat you in a span of 2-3 days, which is not possible. Any other system also cannot do it. So it will take its own time, but definitely at the curative level.
Okay. So can homeopathy be used along with as a complementary, especially for the cancer patients?
Yes.
And how do you do that?
Yeah, interestingly, just a few months back, Shankara Institute of Oncology, the head Dr. B.S. Srinath, he took this initiative of opening a homeopathic center in a cancer institute. Because he saw the benefits that is happening through homeopathy with cancer treatments.
Okay.
Like there are certain cases where one thing is we can address their life.
Especially for chemotherapy and all.
Yes.
They are undergoing a lot of pain. How homeopathy addresses this kind of
in chemotherapies, in patients who have already received chemotherapies, we try to, we give homeo medicines to improve their life, the state of their health.
Okay.
Because after chemo they would have gone very weak and it is totally a very deteriorating state. So we try to improve their immunity and they also, after chemo, they are also more prone to infections.
Okay.
So those things can be addressed through homeopathy. I would like to tell that it is very good if you incorporate in cancer conditions homeopathy. Over a period of time, we have seen a lot of changes even in the development of the tumors. Recently, I had a case of prostate cancer. He was around 80 years and he was not ready to go for any radio or chemotherapy. It was a case of prostate. And we also knew that at 80 years, should I really send him for chemo or radio? So he was keen on taking homeo medicines. He was on homeo medicines without any other deterioration of his health till the last breath. Only just 15 days before his death, he actually came down with certain urinary obstruction, and then it went on that way. But that 7 to 8 years he was on homeo medicines without any much change in his general health. And of course the patient was not ready to go for chemo or radio. This we have to, because only when the patient gives us the consent that we are not ready to go for chemo or radio, we will take up those cases.
And you take complete care of them, and then see that they live a life well. Anna? So what are some recent advancements in homeopathic research?
As I said, homeopathy has incorporated huge number of medicines. That is the most recent advancement. That I say, earlier we were practicing with only 50 remedies. Down the lane over 200 years now we are practicing with 5,000 remedies. Whatever is there in the nature is there in homeopathy.
Okay.
So I said we are from the animal kingdom, from the plant, we have also snake poisons, we have also plant remedies. So many new remedies are added. That is one thing. And also the understanding of how homeopathy medicine works. I would emphasize on this nano technology or the nano medicine that is happening now, which actually explains how homeopathic medicine works.
Okay. So how does homeopathy differ from naturopathy?
Naturopathy, in a word I have to tell, we consider more of mind and less of body. Naturopathy, more of body and then less of mind.
Oh, very crisp answer. Nice. What role does homeopathy play in preventive healthcare?
Definitely yes, because preventive medicines are huge. As homeopathy has one of its work is like vaccinations. So homeopathy works very beautifully in preventing. Maybe in epidemics, although many of the preventives effectively have been done through homeopathy. Maybe cholera, maybe malaria, whatever it is. Even in the history, when you go through history of medicine, even in European countries when there was history, epidemics of cholera and all, most effectively well managed cases were from homeopathic hospitals.
Okay. So I think it strengthens the immune system.
Yes.
And also early intervention will help the patients.
Yes.
Isn't it?
Yes.
So how are homeopathic remedies prepared?
Again, you see how this concept of it is actually serial dilutions that happens. For example,
Dilution and again something called as succussion. Yes.
Succussion is giving a vigorous shake to the medicine. And when this is what is understood now through nanomedicine, that research have been done. When you do that shaking process, the whole molecules, water molecules, get absorbed with the medicinal substance. And the whole medicine now is charged more potent than in the crude form.
Okay.
So this becomes more potent, less side effects.
Okay.
So as you potentize, that the whole process of dilution and succussion is called potentization. So as you do this process, homeopathy medicines become more safer.
Okay.
Less side effects.
Less side
effects.
Okay. So can homeopathy be effectively used on allergies?
Definitely, because it is a holistic approach and we are understanding at the immunity level. So I think it is the mainstream. I mean, when you take up allergy, the first line of treatment should be homeopathy.
So you treat the root cause of allergy,
Yes.
and also I think the individual susceptibility is taken care of.
Yes.
Isn't it? So how does homeopathy compare to the traditional Chinese medicine?
Yes.
That is called TCM, I think.
Yes.
Traditional Chinese.
Yeah, traditional Chinese medicine is something like yoga, naturopathy, where they also believe in yin and yang. They also
What is that
use-
yin and yang?
It's positive and negative energy in a gross level,
Okay.
masculine and feminine principle if you go even more deeper. So these both energies are there in all of us.
Okay.
We have both the masculine and the feminine energy. So we understand where the energy is getting deviated. So traditional Chinese medicine, they go with identifying those points, acupuncture points.
Acupressure, acupuncture.
So, but homeopathy, I think it is more with the scientific relevance. We study in a more, I think, in a more systematic way.
Okay.
So it is both.
As you said, subtlety is given a lot of importance.
Yes, it is both.
More than gross,
Yes.
more than identifying some prick points.
Yes.
You are going into a kind of understanding the whole body in a subtle manner.
Yes.
Isn't it? So what is the significance of like yours like?
The main principle of homeopathy is this: similia similibus curenter.
Oh, what is that?
A German phrase. What causes that cures.
Okay.
So whatever
The
is
cause is the cure.
Cause is the cure. Only thing is you are altering the strength or something like the weaker dynamic affection in a body is extinguished by the stronger one. And the stronger one is very similar to the weaker one.
Weaker one. Okay. So how does homeopathy address pediatric conditions like colic and also intestinal disorders?
It is wonderful medicine for pediatric group. I always recommend because huge drug dosing doesn't happen. Very mild medicine. We start just born babies. We give homeo medicines. They do wonderfully well. Even in teething, even colic disorders. Actually, why I understand is children have less defenses.
Okay. So what evidences supports the effectiveness of homeopathy?
It's been there for 200 long years.
That itself is a great evidence, I can say.
And I would like to, there are so many great personalities who have taken homeopathic medicines. They have given their testimonials also. Just recently, even the royal family of England, they were all on homeo medicines only. Queen Victoria, they were all on homeo medicines.
They were all hemophilic.
Yes.
For this homeopathy work,
There, yes. One doctor from Bangalore only was treating them. So it's been so many years, that itself is a validation. Millions of patients have been cured, and they are the persons. See, we don't have someone to
propagate.
Yes.
Our own patients
Our own patients get them. Yes. So that is itself is what I
that
feel.
itself can say how much of value it adds to the society. Can homeopathy help with autoimmune diseases?
Yes, very much. As allergies or autoimmune also, autoimmune disorders like SLEs. Only thing is early intervention in any cases for that matter. Patient has to, this should be the first option. Most of the time patient come with long-term HCQs. In autoimmune, usually HCQs are the first line of treatment. Folates and HCQs they give.
What are HCQs?
They are all hydroquinines, hydrochloroquinines actually, which is the first line of treatment in the conventional medicine for autoimmune disorders.
Okay.
But as I say, it is more of individualistic approach. We understand why their own immune system is working against them.
Okay.
This is what is happening in autoimmune. Your own immune apparatus is working against you.
Okay.
That is why autoimmune disorders comes up. See, when there is a process of healing, there is a certain process that happens. In autoimmune, this process gets exaggerated.
Okay.
That is why it is called as autoimmune.
Okay, so it provides immunity, and that immunity, when it is exaggerated, you get into another kind of disease, something like that?
No. Yes, definitely. And there is something called as, let's take simple what happens with rheumatoid arthritis. There is an inflammatory process that happens in the joints with rheumatoid arthritis patient. That is an autoimmune disorder. Now what happens while in the process of healing? See, I already told you, body has some inherent capacities to heal. We have a
as soon as some foreign body goes inside, it will attack.
Right.
Yeah.
If there is a cut, body tries to repair it through inflammation, through pain and everything. Now in autoimmune disorders, this process of addressing that cure process gets exaggerated. That is why instead of getting cured, the patient suffers from destructions of the tissues there.
Aggravation of the
aggravation of the healing process basically. So that is autoimmune, and definitely homeopathy has wonderful medicines for it.
How do homeopaths determine the right medicine for a patient?
Again, we start from the
history, collecting
the history, childhood, childhood history. Many times in children we take the history of mother during pregnancy.
Even that also affects.
Yes. We have lot of autism cases.
Congenital.
Yeah, we take mother's history during pregnancy, then the history during their childhood days, then any other past history they would have had. They would have had some fever or loose motions which have been addressed with some other medicines. That history is also equally important for us. And then we go with the present history.
Okay.
And then with this comprehensive understanding, we match with the similar medicine that covers all his symptoms, including his physical generals and the physical particulars, with the mental disposition as well.
Can homeopathy be used against injuries, infections?
Yes. Because there is some medicine called as symphytum, arnica, see the
arnica.
Yes.
Arnica was something for hair
also. The beauty of homeopathy is when there is an injury, it addresses the pain as well as it stimulates the tissues. So even in bone injuries, we have remedies called as symphytum, which actually alleviates the pain at the same time heals the bone. Arnica is very good medicine for muscles. Though at the external application it is very good for hair, but internally when it is given, it is very good muscle remedy for the muscle injuries.
Okay. So what is homeopathy compared to Ayurveda?
Now that I'm into Vedas and homeopathy, I would say, because my brother is an Ayurvedic doctor, so when we had discussions, he used to tell me this, one part of Veda, that is the Atharva Veda, we have lost. And it relates too much with the mind. So Ayurveda doesn't give more importance to mind. It is more of three doshas, Vata, Pitta, Kapha. But homeopathy, though the basic understanding of holistic approach is, however, is there in Ayurveda, is also there in homeopathy. But again, we give more importance to mind.
Okay. So can I understand like this? Allopathy is for body, homeopathy is for mind, Ayurveda lifestyle.
Definitely. Yeah. If we integrate at least at this level, I think we can do wonderful to most of the patients.
Okay.
Because this understanding is not there now. Many times people who come from rural background, Madam, you negli ko kortira? That is the question they ask. You treat the cold. They are not at all aware of it.
So my last question to you is, what is the role of patient beliefs in the effectiveness of homeopathy? Should they believe in homeopathy, then only the homeopathic medicine acts on them, or even if they don't believe or anything?
See, any system of medicine, there is this triad of doctor, patient and the disease. Any system of medicine. If I am not a good doctor, if the patient feels, definitely there is some obstruction to the healing process. But in other contexts, if I have to tell, we have treated dogs, we have treated cats, we have treated cows, wonderfully homeopathy. What belief system they will have on homeopathy? So, it is not that basically, but again, that also works in any stream of medicine.
Right. Oh, thank you, Bhavana, for that wonderful insights that you have shared and the experiences that you have gone. I can say it's tremendous experiences, lot of patients, lot of different kinds of diseases, and you have gone very, very deep into that. And I can understand your passion too. So I appreciate the time that you have spent with me today and and given the complete structure of what is holistic health. Thank you so much.
Thank you, Sahana, for getting me into this platform. And you are igniting everybody's mind. So let that spark, ignite everybody, illuminate everybody, and get this insight with this platform.
Thank you so much.